In this video, a nurse will understand the various aspects of the bandaging technique, steps of procedure, article required, aftercare, and most importantly, what to do when things go wrong. In other words, the common clinical errors. It is a strip of material which is used to immobilize and support the injured part of the body. Bandaging is a process in order to protect or cover the wound. So next we are going to discuss about the purposes of the bandaging. There are various purposes of bandaging such as to protect the wound from contamination, to apply the pressure, to protect the wound from the hemorrhage and to protect the wound from the infection. So next we are going to discuss about the various types of bandaging. The types of bandaging are as follows, that is circular bandage, spiral, reverse spiral, spica, figure of 8, jaw, Kaplan, abdominal binder. Recurrent bandaging. Recurrent bandaging is widely used in the blunt body parts or the distal stump, such as head, finger, toe, and limb, turned lengthwise to cover partially by the recurrent turns at the distal part of the stump and secure by the circular turns. So in this, we are going to show you the demonstration of the recurrent bandaging. Equipments required: a tray containing loose gloves, appropriate bandages, scissor, adhesive tape, dressing material like gauze, kidney tray. Recurrent bandaging. Introduce yourself to patient.
Good morning, sir. Myself Shilpa. I'm a science staff from 8 a.m. to 2 p.m. Sir, may I know your name?
Karthik. Check doctor's order sheet. Explain the procedure to patient.
Okay, sir. So, as per your doctor's order, I have to apply a bandage to you.
Perform hand rub. Wear loose gloves. Select the bandage of proper size and material. Put the patient in a comfortable position and provide privacy if required. Support the injured area while bandaging. Face the patient while applying the bandage. Always apply bandage from inner to outer and far to near end. Make 2 circular turns to anchor the bandage. The bandage is applied repeatedly from one side across the top to the other side of the blunt body part. To be able to fix the recurrent turns well, not only the wound but the entire length of the blunt body part should be covered. Recurrent bandages are fixed using circular and spiral turns. Secure the end. Aftercare. Discard the waste according to Biomedical Waste Management Policy. Perform hand hygiene. And document the procedure in nurse's notes. Key points to remember. Always check for the correct size and type of bandaging according to the location of wound. Bandaging should not be too tight so it can interfere with the blood circulation.